Good afternoon, everybody. Welcome to another HM1 in 2021. Today we're going over Chapter 4 of the Corpsman Manual, which is all about medical records. This chapter is pretty long, but I'm just going to kind of give like the gist of what I think is important to know. I'll be honest, like medical records is a lot of number crunching and raw memorization. There are some forms that show up in almost every instruction. Those are the ones to know, and I'll point those out as I see them, as well as just where some forms go. But again, raw memorization. You're probably better off remembering some of the other stuff than you are some of these forms, because I think just with time of studying, a lot of these will kind of pop to the top of your head. So it's something you'll just get with experience and studying the exam. Like a lot of these numbers, it seems like a lot of forms, but once you start getting going, you'll start to memorize them. So first thing, medical outpatient and dental treatment record is NAVMIN 6150/2130. There are a ton of ditties, both clean and dirty, to remember them. I will show you mine later, but NAVMIN 6150/21-30 are all of the not training record, but the medical record jacket. Let's see again, Chapter 16 of P117. Chapter 16 of P117. P117 is the nomenclature for NAVMIN or ManMed, the Manual of Medical Department. It's Chapter 16 is almost always on the bibs, so that's an important one to take a look at. So there's three primary medical records: health record, outpatient record, and inpatient record. So just think outpatient, inpatient, and then health record. Health record is the one that's only for active duty folk. Dental record is for everybody, active duty, reserve members, and their families. Outpatient record is treatment by a person other than the active duty member. So think outpatient record, civilians. Health record, active duty. Dental record, everybody. Inpatient record is what's created for an MTF as a ship inpatient. There are some things called secondary medical records, which are kind of like a shorthand note. They're created for things such as like OB, family advocacy, psychology, psychiatry. So basically like patient notes that don't necessarily go in the immediate medical record. They're kept in a separate file, and they stay in the specialty clinic. Here is one of the first of many forms you'll see, the DD Form 2766, which is the Adult Preventative and Chronic Care Flow Sheet. I'll talk later about what exactly that is. Types of secondary records: convenience, temporary, ancillary. Convenience is, for convenience of the department, not the patient. An example I like to think about this is I used to work in a dermatology clinic, and there's this machine called a light box. A light box is kind of like a standing suntan bed. It's really good for psoriasis and a couple other skin things, but it's primarily if someone has really bad psoriasis, they step in the light box a couple times a week, and then it helps, like the light rays help with the condition. And the convenience record for us was basically a folder that had when the person came, what the temperature was at, or not the temperature, but like what the voltage was at of the machine, because you can make it really, really intense or really, really low. So then we had a running record of how compliant they were with the treatment. So when Doc did his follow-up, good to go. It would have taken forever to scour through all of their medical record notes to see what was the setting 3 times a week. So instead, we just had that file where it would say patient went Monday, Wednesday, Friday, Monday, Wednesday, Friday, and it had all the dates, times, and what temperature, or not temperature, but how strong the rays were when they went. Temporary record documents current course of treatment, most commonly for OB. Though I guess that also kind of sounds like what I just described. Yeah, I don't know if it was one of the two. But either way, draws the point. Temporary. Temporary dental record, so military members TAD without the record and needs emergent treatment. Temporary dental record must need the following 3 forms: Privacy Act, Dental Health Questionnaire, and the Dental Treatment Form. Kind of makes sense. If nothing else, I need to make sure that my Privacy Act is signed and make sure that I have asked them some questions before I dig into their mouth. And what did I do? So, kind of makes sense. Ancillary records, that's original healthcare documented withheld from their primary. It gives some examples of psychiatric treatment or suspected child or spouse abuse. Record management, all records are property of the U.S. government. The CO has ultimate responsibility for all medical records. Patients are not authorized to retain or maintain their original records, and hand carrying their records without permission is prohibited. For the most part, I don't even think people really hand carry their medical records between PCSs. I think it's something that the facilities ship to each other nowadays. Let's see. Talks about opening health records. Let's see. So for civilians that are accepted for officers, the health record is created by the recruiter, and then it's sent to the first duty station. And former enlisted midshipmen keep their health record. Let's see. Health record is open upon starting their enlistment, so typically boot camp. Then report of medical history and report of medical examination. You'll see those forms, 2807, 2808. You'll see those a lot. Let's see. Open for reservists. So I think this is important. The Naval Reserve Personnel Center in New Orleans is the HREC custodian for inactive reservists. So it's important to know. Where do inactive reservist files go? Naval Reserve Center in New Orleans. People who were discharged before 31 January 1994, their stuff sent to the National Personnel Record. And after 31 January 1994, they're sent to the VA. More info on that is in Chapter 16. This is what a dental treatment record looks like. Most of us have seen these a lot before. So again, here's the form number, NAVMED 6150/2130. Prepared when a record is opened or when the existing number is jet. So typically a felt pen is used for all the identifying data because this stuff doesn't tend to change. There are some pencil entries in the upper left block, which command and title because that stuff can change over time. Let's see, Social Security stuff. Fmp codes. This again is something you'll just get used to as you're in, especially if you work in like primary care where you see these all the time. So it's basically a 2-digit number that's before someone's social. I'm honestly just me thinking it's not in the book, but I wonder if there's going to become a day where FMPs kind of disappear because everyone has their own DoD ID number now, including civilians. So honestly, I wonder what the point of having an Fmp code is when all beneficiaries have their own code number now, because civilians also have a DoD ID number. So sponsor, the 20, typically the active duty member. Children 0-1 to 19. Spouses 3-0. Someone can have up to 10 spouses in the military, or 9 spouses and have their Fmp code 30, 31, 32, 33, 34, up to 39. And then it just goes mom, dad, mom, dad. So stepmom, stepdad, mom, dad. Mother-in-law, father-in-law, mom, dad. Other beneficiary authorized, civilian emergencies, and others. Again, this is one you'll just get the hang of doing it. I think asking about Fmp codes is probably something that most likely will only get asked maybe the E3 or E4 level exam, or E4 and E5 maybe. It's really not something that comes up much at the HM1 level, I don't think, unless they're trying to do like a back to basics exam. Talks about their name, last, middle, initial, or last, first, middle, initial in that order. Someone doesn't have a middle initial, it's NMN, stands for no middle name. Alert box, it's that big box. Do they have allergies? Right there. You would check that. Kind of sucks that they blocked this part out. But you see there's the Fmp, there's the social. There's the terminal filing thing, which gets talked about a little bit later. Record category. So is it dental or outpatient? Service and status. Flag officers are special, so theirs get stamped with flag officer and general officer. If they have any special duty stuff, and X gets marked for like flight status, radiation exposure, asbestos. Pencil entries are only stuff that can change, grade or rate. If they're retired or civilian, preferred form of address, and current command active duty. Let's see. Use a label with the MTF on it. Then there's a couple parts, which is shown right there. So let's not touch that too much right now. Part 1 has when they're coming, when's their PRD, what's their home address, what's their UIC. Part 2 is the imprinted Privacy Act statement, which is physically printed on the thing itself. Part 3 is disclosure and counting record. Part 4 is the forensic examination form, and then boom, you get it all right here. Part 1, Part 2, Part 3, Part 4. Let's talk about how you prepare them. So here, this is Part 1, inside front cover. Here's Part 2, front of center page. Here's Part 3, back of center page. There's Part 4, inside back cover. And that's it. I mean, I think it just helps to kind of get a look at what these look like. I mean, see if someone in the medical records can just give you a record to take a look at. Not a patient's record, but like a blank copy of one. I don't know if you can just get those. So, filing health records, terminal digit filing system, based on the last two numbers of their social security. Let's see. And this is kind of how like socials are read in the terminal. So you got your first 2 numbers, you got your second 2 numbers, and then you got your last 5. And this is all really, really confusing. I don't think it's super important to get in the weeds. What is important is the color of the records. So basically, like, there's one of the colors is blanked out on the medical record, so you can easily see where it needs to go. And then they're all certain colors. So like all the orange records will be together, all the greens will be together. And all of these are based on the second to last digit. So the secondary must pair immediately left of the primary numbers. So the second to last digit will say which record it is. I think on the advancement exam, what they'll most ask you is like, which of these nav meds, what color is it? So NavMed 6150/20 is orange, and so forth. It's important to know it starts at 20, ends at 29. And this is a ditty that I heard. I'm going to make it a little more PC because this is a family event. Oh, golly, you got that big white apple, pregnant, run, exclamation point. That was what they taught us in core school. I don't know if they still teach it like that, but that is what they told me. And 11 years later, guess who still remembers? So, again, oh golly, you got that big white apple, pregnant, run. Make your own ditty if that works for you. What helps is remember green before gray. And that's pretty much the only thing you really got to remember. Because other than that, just the acronym, green before gray. See, internal charge, make sure that you're tracking your stuff. There's a NavMed 6150/7, which is a healthcare record receipt. And here, this talks a lot about a lot of forms. Some of these I see pretty often, like the reference audiogram. It really depends on like what questions are in your bib. The SF600 is huge. 2604, that's like the CNFR stuff. 502, 509, 600 again. 522. And even more forms. See, there's a lot. I would only remember these if you see them elsewhere in your exam. Or elsewhere in your bibs. Let's see, verification happens annually. This is kind of funny to me. It shows how old this manual is. It needs an update. It says the end date of annual for records is 2014. I assume it's later than that, unless someone just hasn't been doing them since 2014, about 7 years ago. Let's see. Permanent change of station. Closing. Some circumstances that a record would close. It's all kind of obvious. Let's see. Man, my Discord's gone off the hook. Sorry about that. Missing in action members. So when someone disappears, Fill out an SF600. Someone deserts, 600, easy 603A, NetBed 6150/4. Deliver those to the member CO so they can do their thing. When a deserter is apprehended, the CO of the activity having the jurisdiction must submit a request to BUPERS or the commandant of the Marine Corps. One thing that I think is important to know is that I know for Navy folk, when we think CMC, you think Command Master Chief. Really try to remember that CMC also stands for Commandant of the Marine Corps. I have had questions where, like, I don't know if they were ever right or not, but I've seen CMC as an option, and I just have immediately struck it out because I'm like, what does a Command Master Chief have to do with this program? And sometimes I think that may have been the right answer. They want you to know that CMC has multiple acronyms, so it's kind of a trap. Don't automatically discount the acronym CMC when you're taking your bib because you think it's a command level thing with the Master Chief. CMC is also the Commandant. Man, now I'm getting emails. Whew, appreciate your patience. Let's see. That's retirement. So when someone retires, a new medical record is established, and that's that outpatient record. Because remember, they're not an active duty folk anymore, so they don't get a health record. So I'll make an entry on 600, and then I love how this instruction shows you what a lot of this stuff looks like, or this chapter. So this is at 6150/4. Ship, diagnosis, dates. It's just that abstract of service. Disability. There's VA stuff you got to do. Outpatient forms. Let's take a look. This is kind of important, I think. When a record's lost, you need to open a replacement record. You mark it clearly as replacement, and then do an SF600 explaining why. And basically, you duplicate it whenever something becomes illegible or it's unreadable. A duplicate record is marked. Loose forms get destroyed after a year. Again, 4 parts on a health record. Part 1, PrevMed. Part 2, medical care and treatment. Part 3, physical quals. Part 4, ancillary studies. I think that's important to know. So make some flashcards to drill them out. I mean, RRPR maybe. That'd be kind of hard to make an acronym for. But if you think about like OC health stuff's number 1. Number 2 is treatment. Number 3 is quals. Number 4, ancillary stuff. 2766 is a summary of issues that affect their status. I could read all that, but I think the important thing is just look at it, man. Kind of like the correspondence manual. When you see forms that they show you a picture, those are probably the most important ones. Otherwise, why would the manual take the time in explaining it to you? So again, a lot of stuff like allergies, chronic illness, medicines, hospitalizations, counseling stuff. There's a box at the bottom. And it keeps going on. Family history, screening exams. More. Again, that's the 2766. So I think that 2766 is really the abstract. But the correct name of it is the Adult Preventative and Chronic Care Flow Sheet. Keyword chronic care. So the 2766 has a lot of stuff in it. It's chronic. It's meant to have, it's not a single appointment thing. SF600 is basically like your notes. I think the best way to describe it. They describe this like really crazily, but then when you look at the thing, a 600 is kind of like a blanket form. Date, what happened. Date, what happened. Date, what happened. It's basically a declog for a medical record. Special procedures. A lot of this stuff, I don't want to say is relevant, but with Alta, it's not really at a hospital anyways. I haven't been shipboard yet. See, stuff you put on there. You pretty much put anything in the SF600 according to all the bibs. Like if you don't know what form something goes on, if 600 is an option, it's probably the right one. There is, let's see, the next big form is the Certificate of Vaccination, PHS 731. I would say know that. That's basically, it's supposed to be in someone's possession, and it's issued for independent international travel, basically saying you're allowed to go to different countries. That's not to be filed in the health record, because all of your immunizations should be on your chronic care flow sheet, your 2766. see. Then proof of getting that vaccine is stamped and signed. This one's the abstract, the 6150/4. And that has a chronicle history of their duty stations, which they've gotten treatment and abstract medical history. So I think a 6150/4 is just kind of like the Cliff Notes. Where'd you go? What happened and where? 1141, ionizing radiation. I would remember this radiation health protection manual. NAVMed P5055. Reason being, like, even if it's not like the question it's looking for, I see like a lot of questions where it's like, what's the 5010? What's the 117? What's the 5055? 5010, I already said that. And it'll give you like all three of the manuals, or all four of the manuals, and then one made up one. So if you know what they all are, you'll probably get that question right. So even if it's not what the question's asking, you'll know, well, I know radiation has nothing to do with whatever this question's asking, so it can't be that one. Let's see, a little narrative summary. That's kind of just a blank, write whatever you want there. The acronym I remembered for narrative summary 502, SF 502, Cinderella lost her shoe. Sounds similar, right? Consultation sheet is when you request a consult from somebody. Eyewear prescription 771. It doesn't really look like eyeglasses, but 771 to me kind of looks like glasses when you tilt your head to the side. That's how I remember that one. Some dental record forms. 6630/3 is the treatment one. Actually, no, that's the health questionnaire. So 6630/1 is the, or 6600/3 is the questionnaire. Let's see. And man, I wish they had like an exact. Yeah, so NAVMed 6600/3 dental health questionnaire. Boom, right there. And the dental exam one is the easy 603. Ooh, that made that difficult. So questionnaire is the 6600/3. And the easy 603 is the dental exam. And this just goes over the parts. So again, that's where you get your flashcards out and remember it. This is a big form. 522. That is the request for anesthesia and for performance of ops and other procedures. So remember 502's narrative. 522 is your think of like your lidocaine anesthesia stuff. See, security. So Privacy Act of 1974. HIPAA is a thing. Record custody. It generally stays in the medical department. When a patient is transferred to treatment facility, the HREC typically accompanies the patient. And the HREC should be forwarded as soon as possible. Releasing medical information. Don't do it. Unless someone above you tells you. Typically you don't. Especially at our level, we don't tell anyone anything. That is our boss's job, man. That's the PAO's job to release stuff to the public. There is some stuff that the CO can release to the public in the case of an accident or something. So name, grade or rank, date of admission, age, sex component, base station, organization, general condition. Can't say much like, hey, yeah, Sergeant Joe, he was admitted yesterday, he's fine. That's really all they can tell you. Releasing state authorities. Doesn't happen too often. There's some caveats. Yeah, that's it. So this one was a little bit longer than usual. Medical records. Read this chapter, especially brief, just to be familiar with it. I wouldn't spend a whole heck of a lot of time studying this one, but it is important just to kind of review. I would say the P117 is probably even more important in Chapter 16 when it's on your bib. If it's not on your bib, I wouldn't worry about it because you have so much other stuff you should be studying. But if you see that man-med chapter P117 on there, give it a read, man. Because there's typically some questions about medical records, I think, on every exam, always. Just stuff to focus on. And that's all I got. Let me just scroll back up to the front. Thank you guys for joining in. Apologize for those Discord beeps. I normally mute my channel when I'm doing YouTube videos, and I'm going to try to edit them out so they're not as distracting, but we'll see. Have a good night.